Good afternoon, everyone, and thank you for joining us today. COVID-19 continues to create challenges for all Manitobans as we continue to adjust our daily lives to help flatten the curve to protect the health of our families, friends, and communities. I want to take this time to thank the childcare centres who have opened their doors without hesitation to provide childcare for our frontline healthcare and other emergency service workers. As of March 31st, 350 licensed childcare centres and home-based providers have opened up more than 1,600 spaces. We have connected over 1,200 children and continue to work with providers and parents to match families with the remaining spaces. To all of you who have stepped up to provide childcare during this global pandemic, you truly are heroes helping our frontline health heroes. Over the past few days, our government has been reaching out to a number of closed childcare centres that continue to receive provincial government grants, but remain closed across the province. We are asking them to open up to care for a maximum of 16 children in centres and up to 8 children in home-based facilities, as per the recommendations outlined by the Chief Provincial Public Health Officer. The province will continue to provide nearly $30 million in operating grants to all licensed childcare centres, fully covering the operating grants over the next 3 months. In return, we are asking closed childcare centres to open to help assist our critical service workers and provide them with childcare services that they need. I also want to be clear that childcare centres should be returning parent fees if childcare has not been provided to those families, and they should not charge parents to hold spots during these uncertain times. We have also partnered with the Manitoba and Winnipeg Chambers of Commerce to expand home and community-based childcare options. This includes an $18 million provincial grant program to assist early childhood educators with the startup costs to operate childcare services in their homes or in their community. Manitobans support other Manitobans in times of need. It's just what we do. Now is not the time for exceptions. We have seen the success of our Help Next Door MB.ca online tool to help match volunteers with those who need assistance. We have seen communities come together across the province to support each other during these hard times. From children building snowmen outside personal care homes to local companies like Farmery Brewery and others retooling their facilities to manufacture hand sanitizer for healthcare facilities and frontline workers. And to all of those who have stepped up, we thank you. I want to also thank the disability community who have stepped up and have gone above and beyond when it comes to providing care for our most vulnerable citizens. Agencies across our province that provide services to people with disabilities have coordinated all of their efforts through Abilities Manitoba. They have taken steps together to redeploy staff so that residential services can continue for people with disabilities across our province. Our ask of childcare centres is no different. We all must do our part to help Manitobans in our time of need. Today, we are also requesting that all healthcare and other critical services workers submit their applications for childcare by April 8th. This includes healthcare workers, emergency service providers, corrections workers, law enforcement, fire and paramedic, direct social service workers, and child protection workers. Beginning on April 14th, all parents who work in critical services, as set out under the order of the Chief Provincial Public Health Officer, will be eligible to seek childcare spaces in licensed facilities. I'd like to thank all parents and all childcare workers for their patience during this difficult time. This is an ever-evolving situation, and we are responding daily to new developments. As we continue to navigate the changes caused by COVID-19 together, I also want to once again thank families, early childhood educators, our childcare centers, boards of directors, and all of the people who are finding ways to help our heroes who are fighting this pandemic. You too are heroes who are making a very challenging time a little easier for Manitoba's children and families. And for that, I thank you. And happy to take any questions.
Thank you, Minister. A reminder to the reporters online, you will have a primary question, follow-up question. First up from City News, Jess. No questions. On to Diana, CJOB.
Good afternoon, Minister Stefanson, Diana from 680 CJOB. What do you say to the child care providers who have closed, and say any of the parents there who are frontline workers whose kids attend their programs, they've made other options, so they wouldn't have any kids to take care of as it stands? What would you say to those child care providers?
Well, certainly we are asking parents where possible to find alternate arrangements for their children, whether it's other family members or neighbors and other friends. So we have asked that. But we also know that there is a need for other childcare, frontline healthcare workers for childcare and also for other essential service or other critical service workers as well, those in the emergency area. And also those critical service workers who were part of what was announced on Monday, I believe, by the Chief Provincial Public Health Officer. So we know there is a need and a demand for childcare out there, and so we'll continue to call on those other facilities who are closed right now to say, please, could you open up and be part of the solution here? And we hope they will.
And just as a follow-up, obviously you mentioned the more than 1,200 children of those frontline workers already in matchless spaces. Do you have any idea roughly how big the demand is, like as a whole? How many more spaces are you hoping to get?
Yeah, and so that's a great question, Diana. And I think what we're looking for is we're calling on those healthcare providers, those frontline healthcare providers, to come forward at this time to ensure that we know by next Wednesday, who needs the childcare so we can provide it to them. Of the 1,200, I believe it's a little over 80% of those that have been placed. So we're continuing to work with childcare facilities to ensure that those frontline healthcare workers and emergency workers are able to get the childcare they need.
From Global.
Hi, Kevin from Global News. You're wondering if you have the numbers on how many spaces are open right now and how many you're reaching out to that are currently closed at this moment.
Yeah, certainly we can get the details of all of those numbers to you. I don't have those at my fingertips right now.
Okay. And I guess my follow-up, so to prioritize the children of the healthcare workers, does this mean, I guess, other children will get bumped, and what's kind of the process there? How do you determine, who gets bumped, if that's something that's going to happen?
Yeah, no, we are placing, we've had a triage system that the department has been working with open childcare facilities to ensure that those frontline healthcare workers get the childcare that they need first, along with emergency services such as, police, correctional officers, and so on, who need those services first. We did prioritize those, and we're encouraging them to come forward by next Wednesday so that we can establish what their need is first. And then we'll look at the other critical service providers as set out in the order by the Chief Provincial Public Health Officer for those who need it, who are critical service workers who need childcare as well.
From the Winnipeg Free Press, Katie.
Good afternoon. It's Katie May at the Winnipeg Free Press. I'm wondering if you can speak to whether Manitoba will issue a moratorium on youth who are otherwise going to be aging out of the child welfare system during this pandemic.
Yeah, thanks, Katie, for that question. And we have a system already that works with those children who are permanent wards of the province. And we have a system already in place. So we are ahead of other jurisdictions already on a regular basis with how we deal with that. We do, however, recognize that there is a need in the other areas. And we're in the process of working on that right now. And we'll be out on that shortly.
Thank you. And to follow up on this announcement, when you are saying that child care centers should not charge parents to hold spots, are you issuing any sort of directive to ensure that they don't?
Right now, those child care centers have established relationships with the families, and what we're saying is that this is unprecedented times during this pandemic, and we just hope they would do the right thing and not charge those parents fees for services that aren't rendered.
Scott.
Hi, Scott Billick here from the Winnipeg Sun. Just a question. Is there a backlog of right now of folks looking to get their children in and there just isn't spaces right now? Just wanting some clarification on that.
Yeah, no, there isn't right now, but we know there will be an increase in the demand because right now we've been asking just for healthcare workers as well as those emergency service workers to come forward with their needs. Now with the Chief Provincial Public Health Officer coming out earlier this week with the critical services list, there will be more people who will be added to that, and that's why we are reaching out to those facilities who are receiving their full provincial government grant to please remain open so that we can provide those necessary services to those critical service providers during this global pandemic.
Yeah, and my follow-up is obviously there's fear and whatever. These child care places that may have closed. I mean, that obviously is concerns there. What can you kind of say to allay those fears, I suppose?
Well, I think we certainly take our advice from the Chief Provincial Public Health Officer. He has stated that that it's fine for these facilities to stay open with up to 16 children. And so we'll again continue to take our advice from the Chief Provincial Public Health Officer on those issues.
Thank you. From CTV Winnipeg, Mason.
Hi. So what happens if those child care places choose to stay closed? Will the province take away funding?
No, the funding will flow to them for the next 3 months. We have made that issue already, but we do expect that people will step up. This is unprecedented times. Manitobans need our help right now, and I know those facilities, I hope, will see that there is that need and do the right thing here. So we're really calling on them to get their help and support for those people who are working out there on the front lines to help during this global pandemic. These are unprecedented times.
From CBC Radio Canada, Ezra.
Hi, Ezra Belkuno from CBC, French CBC. First, I wanted to see if it was possible for you to get a French comment en française, and also I wanted to know, I understand that it's a special moment, critical moment, but in your efforts to match some health workers with places for their kids, were you able to make sure that French-speaking kids were placed into French-speaking kindergarten? Was it possible for you guys over there?
Thank you, Ezra. I appreciate your comment, and certainly I will endeavor to get something to you en français. Merci beaucoup. What I will say is that, yes, where there is a need and there is a child who is of French speaking, we will try and endeavor to match those to appropriate facilities. We do need those facilities, obviously, to come forward and to provide those services as well. And so we will continue to call call on all of those facilities who get provincial funding to come forward at this time. But we will endeavour, where possible, to match those French-speaking individuals with French services.
Okay, just a follow-up. Since the beginning of it all, have you had a chance to speak with French-speaking centers for kids, saying that we're open and we can get some? Has that already happened?
Yes, our department has reached out to all of the childcare facilities in the province, including the French-speaking childcare centers as well, and so we will continue to do so.
Thank you for your answer.
Thank you.
From AP National News, Brittany.
Good afternoon, Minister Brittany Hobson from APTN National News. Just a follow-up to Katie's question. As I understand it, what you guys have in place already for youth aging out of care, the services provided don't necessarily get extended for every person once they turn 18, and I think that's what some people are looking for. So is there any plan to just halt altogether youth aging out of care at this time?
Yeah, this is very much on my radar. Again, we do offer those to some, as you mentioned already, and we will be looking to look after the rest of those. So please stay tuned. We'll be coming forward with something very soon.
Thank you. No follow-up.
Thank you.
All right, ladies and gentlemen, thank you very much. That concludes today's media briefing.